Okay, and we are live. Morning, everyone. Welcome to the media briefing for Friday, May 15th. Today, we will hear from Acting Medical Officer of Health, Dr. Hsiu-Li Wang. We'll also hear from Regional Chair Karen Redman, and then we'll have an operational update from Region of Waterloo CAO Mike Murray. And we will get things started right now with Dr. Hsiu-Li Wang. Go ahead, Hsiu-Li.
Yes, good morning. So my update this morning will be long, just so you all know. So this morning you may have noticed a change, a little bit of a change in the epi curves on our dashboard. They now reflect cases either related to an outbreak, whether in a congregate setting such as a long-term care home or retirement home or group home, as well as other outbreaks like the Conestoga meats outbreak, and separately community cases. Community cases are those not associated with a specific outbreak and where the transmission is thought to be due to close contact with another case from travel or from somewhere else in the community. Regarding testing numbers, so we are one of the health units that tracks and reports testing numbers on our public dashboard. Our numbers are provided by multiple sources, including our testing partners and from long-term care homes and retirement homes. This takes time and effort to put together. Since we first released our dashboard, we have been engaged in data quality checks. With the multiple sources, we wanted to be careful that we would not double count the number of tests that have been done. In the end, we ended up undercounting the total number of tests that have been done. So as part of this data reconciliation, we expect a significant rise in the total number of tests completed as of tomorrow morning, Saturday morning's refresh. We estimate the total number of tests will increase by roughly 3,000. With respect to testing, as I had previously mentioned, we have been working very diligently with our clinical testing partners to be ready to expand testing to symptomatic residents in the general public in our community. So on behalf of the testing partners, I am pleased to announce that beginning today, as per provincial guidance, all residents with symptoms will be eligible for testing. We have completed whole home testing of all long-term care homes. Completing this one-time whole home testing means that our testing partners now have the capacity to test more residents. The province has also worked hard to expand testing capacity across Ontario and improve the overall lab system. They have indicated to us that they have the capacity. So there are 5 assessment centers in the region. 3, as you may know, are located at the area hospitals, and there are the 2 community assessment centers. So they all take referrals from primary care physicians, and there will be self-referral options for St. Mary's and Grand Rivers centers coming very soon. So possibly right after I finish this briefing, we'll have an update on when. And so information for their locations, hours of operation, will be available very shortly on our updated webpage regarding the assessment centers. And we're just going to update that webpage after the briefing. Finally, our website's new link to the Ontario Health West's self-assessment tool, which is based on the provincial tool, and which is brought to us courtesy of eHealth Center of Excellence for Waterloo Region, can help streamline the assessment and referral for testing. It can make it easier for residents who are experiencing symptoms to connect with a primary care provider virtually and ultimately get a referral to be tested at one of our assessment centers. Just to note, since this tool is based on the province's self-assessment tool, if the latter has not yet been updated with the latest provincial guidance that opens up testing to all symptomatic residents, if residents receive a message to self-isolate at home, please remember that beginning today, all residents with symptoms in Waterloo Region are now eligible for testing. Conestoga Meets, I wanted to provide an update on our public health investigation of cases at Conestoga Meets. Public Health is continuing to refer for testing any employees at Conestoga Meets who become symptomatic and are reviewing the cases extensively. We are monitoring closely in partnership with the Ministry of Labor to determine the effectiveness of the enhanced PPE and other safety procedures that were put in place prior to their reopening on May the 4th. As a result of the tests that have continued to come in, as of May 14th, we are at 75 positive cases among workers, and 41 of them have resolved. Public Health continues to work closely with the management at the plants, and as mentioned previously, they have implemented a significant number of preventative measures, meeting or exceeding recommendations from Public Health and the Ministry of Labor. Although we continue to see cases or reports of positive tests come in, as you've seen, the number of positive reports has slowed. All the cases we have seen so far were possibly exposed during the period prior to the reopening of the plant, or may have been exposed in locations outside of Conestoga Meets. While it is too early at this point to make any conclusions regarding the effectiveness of the changes made to the plant, we have no indications at this time there is an ongoing risk related to practices at the plant. The number of cases being reported, as I mentioned, has decreased, and we are optimistic that the controls the controls that have been put in place are having a positive impact. As we continue to receive and closely monitor new reports of positive cases, we will continue to assess the impact of the prevention measures that were put in place at the plant. As mentioned before, there continues to be the potential of outside influence for the transmission of the virus among the workers at Conestoga Meets, as there is a considerable amount of social interaction between employees. Many live together and or have carpooled together, which can increase the risk of transmission in situations that are external to Conestoga Meets. Conestoga Meets has worked with their employees to provide additional education and support on reducing the spread of COVID-19 at home outside of the plant. So in closing, I would like to thank our clinical testing partners. They have been working tirelessly to make this expansion possible. While we have seen our testing numbers increase significantly over several weeks, it's also important to reiterate the effectiveness of public health measures. Testing is a monitoring tool that allows us to identify the virus is in our community and manage positive cases accordingly. But it does not prevent the virus. It is critical that everyone continue to practice public health measures, especially as we head into the long weekend and more places begin to reopen. This is not to say that you must stay home. Rather, when you do go out, whether it is for a walk or a bike ride or going to the grocery store, I ask you to continue to spend time with your household contacts only. Do not gather in groups of more than 5. Keep 2 meters between yourself and others when you do go out. I encourage you to wear non-medical masks, such as cloth masks or face coverings, if 2 meters cannot be maintained, which is likely going to be increasingly the case as there are more people outside because restrictions have been lifted. And please continue to wash your hands or use alcohol-based hand sanitizer when water and soap are not available. These measures are our best defense to prevent the spread of COVID-19. Let's continue to work together. Thank you very much.
Thank you, Dr. Wang. We'll now hear from Regional Chair Karen Redman. Go ahead, Karen.
Thanks, Julie. I'm so proud of Waterloo Region as we continue to persevere through this pandemic. One of the most positive things that have come from this pandemic is seeing how our community comes together in times of need. Through creativity and collaboration, the region and our partners are providing supports to our community despite the challenges of COVID-19. This week, I learned 2 examples of this. In the area of housing, the region of Waterloo and its community partners continue to find homes for people who need them the most. In April, Lutherwood, the emergency shelters and street outreach agencies worked together to support 10 families and 2 individuals who were homeless into community housing, and another 15 households will move into units this month. In the area of supplying connectivity to students, the region of Waterloo, in partnership with 4 local charitable foundations in the Smart Waterloo Region Network, have successfully raised enough money to cover internet costs for students of 1,500 families in the region. This will ensure that all of these students can stay engaged and keep up with their schoolwork until school begins. As the province begins to open up, it's more important than ever to keep up or even to increase physical distancing measures. This is not the time to relax. Until a vaccine is developed or an effective treatment discovered, public health measures will be a part of our everyday lives in all settings. Our new normal will still include physical distancing, hand washing, and wearing a face covering. I recommend wearing face covering when you cannot maintain safe physical distance to prevent the spread of your germs to others, even if you're not experiencing symptoms. If everybody did this, sorry, can you hear me now?
Yeah, we can now.
Sorry. If everyone were to wear masks when they couldn't physically distance, we could limit the spread significantly. This is mine, and I bought it from a neighbor who is making cloth masks for everybody who needs them. The weather is getting nicer and the urge to be outside is getting greater, especially this first long weekend. It is our unofficial start to summer. But this year, the Victoria Day weekend will feel a little bit different due to COVID-19. All public events and celebrations across Waterloo Region have been canceled. We're asking you not to set off fireworks in municipal parks, fields, laneways, school properties, and try to find other ways to celebrate without fireworks. We're asking you this for 2 reasons. The first is discourage large gatherings, and the second is to limit firework-related injuries. We don't want to put additional pressure on emergency responders and hospitals. Personally, this weekend, I'm looking forward to a drive-by by my daughter and son-in-law with our 3 grandchildren. And if it's not raining, our son and his wife will bring their Westie dog over to play with our Westie in the backyard. They mostly chase squirrels, but it's fun to watch. Whatever you choose to do this long weekend, please be safe and remember to include your physical distancing in your plans. Thank you.
Thank you, Karen. We will now hear from Region of Waterloo CAO, Mike Murray. Go ahead, Mike.
Okay, thanks, Julie. So I've got 3 pretty operational updates today. One is just reinforcing messages that were communicated yesterday about area municipalities relaxing rules at parks and open spaces that I think most of the media outlets have probably seen. But just to reinforce some of the changes, and I'll read from parts of that media release. Access to municipal parks and open spaces is permitted for some recreational uses. Examples of recreational activities that are now permissible include playing catch, throwing a frisbee, kicking a ball, flying a kite with members of your household. Park visitors can bring their chairs or blankets for sitting. Individual activities, including personal fitness exercises or yoga practice, not group classes. So, you know, additional activities permitted other than just walking through parks. But as people do that, this is going to sound like a very familiar message, residents are still required to practice 2-meter physical distancing, limit public gatherings to groups of 5 or less people not part of the same household, and all of the ongoing advice about you know, personal hygiene continues. So while additional activities will be permitted in parks, open spaces, and trails, there are other outdoor recreational amenities that remain closed in alignment with the ongoing provincial order. So things that continue to be closed include play structures, shelters, washrooms, splash pads, picnic tables, sports fields, basketball and tennis courts, dog parks, and skate parks. So some additional activity permitted in parks, some things still closed, maintain physical distancing, stay to groups less than 5. So that's parks and recreation. Next operational update relates to waste collection. So waste collection continues as normal on holiday Monday, May the 18th. However, as with all other statutory holidays, on the holiday Monday, the Cambridge and Waterloo small vehicle transfer stations are closed. So this is not a pandemic related. This is, you know, our normal operating practice on statutory holidays. But we know those small vehicle transfer stations have seen lots of activity, and we just want to remind people they are closed on holiday Monday, but regular curbside waste collection will continue on the holiday Monday. That's waste management. The other update I just want to provide, as businesses start to consider reopening, our water services and public health folks have prepared a fact sheet about how to safely reopen water supplies in large buildings. And so water systems in large buildings that have sat dormant for 2 months, there are certain things that need to be done to restart those water systems safely. And the water services and public health teams have put together a fact sheet with guidelines about how to do that safely. I won't go through all of those details here, but it is available on the region's website at regionofwaterloo.ca on the Living Here section of our website. So any businesses that are responsible for large indoor water systems in buildings should probably have a look at that as they contemplate opening up. So those are my operational updates. And as with Chair Redman and Dr. Wang, happy to answer any questions.
Thank you, Mike. And thanks to all of our presenters. We'll now turn it over to your questions, and we'll start with Joanna from the Record. Go ahead, Joanna.
Thank you. A couple questions for Dr. Wang related to the testing. So can you explain a bit more about why you expect the numbers to rise tomorrow for the number of tests done?
Sure. So as part of our sort of data quality assurance process, we looked further into the number of tests that we were posting every day. That was a accumulation of all the testing numbers from our partners. It's an endeavor that requires work and time because people send us numbers and we have to put them together. And our team was wanting to be really careful not to double count numbers. And as we were doing the quality assurance checks, we came to the realization we were actually under counting numbers. We will look into the specific reasons why, but it's possible it was due to just really being perhaps overly cautious and not wanting to double count. We ended up actually undercounting. And so we have now reconciled all that data, and it will be updated as of tomorrow's update. It will be ready for tomorrow's update. And then it will show the true number of tests that have been conducted across all our testing partners up until now. And so that is why the numbers will significantly jump from today and tomorrow. It's because of the data refresh on tomorrow's dashboard. Yeah, and then that way, we'll have the correct numbers going forward.
And just recent data that was released shows that the region is has the lowest testing rate per capita across the province. Do you expect then that adding these extra tests will push us sort of on par with other areas, or how can you explain that?
Yeah, I don't have the answer to that question right now, but we're going to look into that later. Yeah, right now we just want to make sure that the data on our local dashboard is the correct number, but we'll look into that as well.
But do you expect though that will make us sort of more average in the province?
Yeah, I wouldn't be able to say at this moment.
Okay, but for anyone who's looking at those numbers and sees that the region is way below other areas in the province, like that would be concerning then, because I know a number of tests that we're doing here that's been discussed quite a bit in the briefings and just in the public.
Yeah, so we've been continuing to increase the numbers. We have been working. As I mentioned, public health doesn't actually do the testing. It is our clinical testing partners who do the testing. We've been discussing with them our testing rates in the region, and they've been working hard and continue to work hard to continue to increase the numbers that are tested in our region. And the trend that we've been seeing is that's been the case, that they've continued to increase over time. And as I mentioned, they worked really hard in the last several days to be able to expand testing as of today to all members of to all symptomatic residents in our community. And so I think that's another sign that we're continuing to, the testing partners are doing their best to continue to increase the numbers tested in the community.
All right, thank you. Those are my questions for now.
Thank you.
Thanks, Joanna. We'll move on to Tim from 570. Go ahead, Tim.
Yeah, Dr. Wang, you said 5 testing areas, 3 in hospitals. Which are the other 2 again?
One of them is actually located at Cambridge Memorial Hospital, but it's not a hospital site. It's a community assessment site. It's a different entrance, but it's the same location, which is Cambridge Memorial Hospital. We'll have those specifics on our website very shortly after this call. We're just getting some final details from the testing centers in terms of information. The other one is at the Westmount Plaza, the one that's in Waterloo. See if I can pull up the address. I'm not very good with remembering addresses.
I think it's in Kitchener at the corner of Victoria and Westmount.
Yes, okay, thank you. But it'll be on our website very soon.
Okay, and with virtual testing, what does that involve? Like with the self-assessment, is that something with to do with telehealth or anything like that?
No, it's a tool that was coordinated by the eHealth Center of Excellence for Waterloo Region in collaboration with Ontario Health West, which is really the owner of the tool. And what it does is it allows any of our residents who take the self-assessment tool that the province has put out to be able to then virtually connect with the healthcare provider, to be virtually assessed, and then referred on to testing as indicated. So it is a mechanism that will help streamline for people who may be having difficulty either reaching their primary care provider or who don't have a primary care provider, to be able to quickly connect to another primary care provider virtually, and then receive through this provider a referral for testing. So we'll hopefully streamline access to assessment by a primary care provider and access to getting a referral to one of the testing sites. One thing just to be aware of is that because this tool is based on the provincial tool, it may still ask people to self-isolate, right? Because the provincial change to their guidance occurred yesterday. So I'm not too sure exactly where they're at with updating their tool. I'm sure they're working on it right now. Maybe it's already done as we speak, but I'm just not sure of that. And so previously the tool asked some people who were not in the priority groups to be tested to stay home. And what we're just wanting people to know is, as of today in Waterloo Region, people can be referred for testing, and anyone that's symptomatic in the community can be referred for testing. And so we're getting the message out, to our physicians and to the general public. And so, in case the tool still says stay at home, they should stay at home always if they have symptoms. But in addition, they are now also eligible for testing if they have symptoms.
And if someone is non-symptomatic and they're still worried about getting tested or anything, how do you make sure there's not an overload of people that are not symptomatic to make sure that they don't get tested?
So that's why there's some form of assessment that will take place either through a primary care practitioner, or we expect that a couple of the assessment centers will be able to take self-referrals from people, but there will be some sort of screening or assessment that will take place, because currently the recommendation from the province is that people who are symptomatic in the community are the ones who should be tested.
That's great. Thank you so much.
Thank you.
Thanks, Tim. We will move on to Paula from CBC. Go ahead, Paula.
Hi. So about the testing, we've heard in the past that some tests are being sent to labs in other cities in Ontario to be processed. Can you tell us how many of our tests are being processed outside of the region, and then how many are processed here?
I don't have that exact number, but the vast majority are processed outside our region, and that's always been the case. Grand River Hospital does have a lab that I believe they're working closely with the province on in order to be able to process a certain number of tests locally, but the vast majority for now are still being processed outside of our region. And that's always been the case, and it's the case for a number of places in Ontario as well. There are certain major labs in Ontario. They're not in all places.
And are there any plans at this point to start doing more tests locally anytime soon?
That would be a provincial lab system decision.
Okay, fair enough. And then just regarding what you'd mentioned previously about how you'd wound up kind of undercounting the number of local tests, do you know if any other public health units in the province are in a similar position, or is this kind of unique to Waterloo region?
My understanding is, it could have changed since I heard it just a few days ago, but my understanding is that most large public health units do not publish testing numbers because they don't do the tests. And they would have to do what we do, which is collate from all of the different partners and update it every day. So we're one of the health units that does that. And so that's why you have those numbers. So yeah, so I wouldn't know, how they would. My understanding is that most of the large health units don't do this, and so I wouldn't know what their numbers would be like.
Mm-hmm. And then just real quick on a completely different note, does the region or does public health have any information or guidance at this point about summer camps and whether those will be allowed to operate this year?
Paula, we have no information, but I want you to know that my two daughters, who are both mothers, keep asking me all the time if we have any intel. I think as parents look at the summer ahead, it's a huge preoccupation knowing for certain whether they're on or not. And I don't think anyone has that information at this point.
Okay, thank you.
Thanks, Paula. We'll turn it over to Irene from Air News. Go ahead, Irene.
Hello, I had a question for Dr. Wang, and just getting to it. Is Waterloo region receiving any special attention from the province because of the over-average death rate? Because even with the Forest Heights numbers removed, Waterloo region is still over the provincial average for deaths.
No, I don't think actually that there's an increased risk in Waterloo region compared to other areas. We do have a more elevated death risk. A more elevated death rate because of outbreaks like Forest Heights. But the death rate varies very substantially between health units due to whether or not they have outbreaks in long-term care homes, and especially if any have significant outbreaks. There are other health units in Ontario where they've had significant outbreaks, like the one here in Forest Heights, and then their death rates are very high as a consequence. So I believe it is really related to some unique outbreaks that we've had here in Waterloo region, in particular, Forest Heights.
Okay. I guess from where we are in North Dumfries, just across the road in Brant County, the death rate is 3%, and the other road into Blandford Blenheim, it's 6%. And you're right, I checked; they don't have any outbreaks in their long-term care homes in at least Brant County. But I guess that further to that question, does that mean that the province will be looking into processes in the long-term care homes to see why Waterloo region was hit so badly?
Yeah, I believe that there are issues across long-term care homes, in long-term care homes, across the province, and that it's, as we're seeing with the trends that we're seeing, homes are can be very affected in a small number of cases, and in a large number of cases, not very affected at all. And so I understand the province will be looking at that because there are differences, as you pointed out, Irene, across homes. I do not believe that there is an increased risk in Waterloo region to deaths. I mean, 81% of our deaths are related to outbreaks in long-term care homes and retirement homes. So most of the deaths are there. But I understand, and I understand the province will be looking at the long-term care home system in general across the province.
That's it. That's it. Thank you.
Thank you, Irene. Okay, we'll turn it over to Nicole from CTV. Go ahead, Nicole.
Hi, good afternoon. This is for Dr. Wang. On Wednesday, you had talked about lab capacity. You have to, to find balance because you don't want to overwhelm the system, and had talked about, backlog issues. On Wednesday, Dr. Barbara Jaffe sounded confident about the lab capacity in the province and wasn't aware of overwhelming the lab capacity. She said that she was unaware of what was going on here and that local public health units should contact her if there was an issue. And it sounds as though you've had that conversation. What was said in that conversation since Wednesday? What has improved the lab capacity in your mind in order to expand testing?
So, even before last Wednesday, we have been escalating the lab issues that we've been experiencing up. And, the last several days, the province has been responsive in communicating with us and working very hard to try to resolve the issues that we've brought forward. So in the last couple of days, there's been a lot of work, and we've been told that the issues that we've escalated have been resolved or are being resolved, and that the province is confident that the lab system has the capacity. We were given very specific instructions about who to escalate the lab issues to at the provincial level, and we did that. And the lab system partners responded to us quickly in the last several days. In the last few days.
So what is lab capacity like right now then?
That would be a question that you would need to ask the provincial lab system. But what I can tell you is that we have been fulfilling the provincial directive through our lab testing partners and through the homes who do the testing to complete whole home testing of long-term care homes in our region by the end of this week. And I understand that we have met that target. And so the number of tests that are going to be going into the labs from all that whole home testing, which involves oftentimes hundreds of people in a home, all of that is winding down because we've met that met that target. And I understand it's the same thing across the province. So there will be a significant decrease in the number of lab samples that go in from that whole home testing. And the province has indicated that it has the capacity, and that is, I'm assuming that's one of the reasons they announced yesterday that their guidance is now recommending that anyone with symptoms in the community be tested. And I know they've been very responsive. The provincial lab system people that we've talked to have been very responsive in the last few days to the concerns that we've raised and have been very prompt in getting back to us about them. So I'm very appreciative of that as well.
Okay, thank you. This question is either for Karen Redman or Mike Murray. Other municipalities have actually banned the sale and use of fireworks. Why haven't you done that here locally?
So what I would say is in our interesting two-tier municipal system, regulating sale or use of fireworks is a responsibility of the local municipalities, not the region. And I know that they've had discussions about that, and they quite consciously landed where, you know, they've communicated and we've communicated, which is, you know, there's certain fireworks activities that are not happening. There's certain things that are banned. Use of fireworks in public places are banned, and they'll enforce that. What they haven't banned is the sale of fireworks and the use on private property of fireworks, which remains legal, but they're encouraging people to do that responsibly, you know, consistent with no more than 5 people, physical distancing, and trying to be as conscious of safety as possible. So they looked at all the alternatives and they concluded that that was most appropriate for our circumstances. And, you know, I think given our experience with relatively significant compliance in this community, I think they're comfortable that people in Waterloo region will do the right thing, because that's what we've seen over the last 8 weeks.
A bit of confusion, I guess, on my part. Is Rim Park allowed to open? And if it is, what happens to it if it still is considered as an overflow hospital? Like, what's in place for that?
Yeah, that is something specifically you'd have to talk to the city of Waterloo about. I don't think they have any immediate plans to open Rim Park. I think the cities have said that those municipal recreation facilities are closed until at least June 30th. You're muted, Nicole.
Sorry. What can we expect Waterloo region, I guess, folks to do to ensure that the businesses that are reopening on Tuesday are in compliance to the guidelines provided by the province? Like, are you putting more boots on the ground?
Yep. So again, you've heard this from me before. There are at least 4 different sets of organizations that are doing monitoring and compliance and enforcement. So regional public health inspectors will be out and about. Regional bylaw enforcement will be out and about. Area municipal bylaw enforcement will be out and about, and Waterloo Region Police will be out and about, monitoring for compliance with all the guidelines. And you know, our call center continues to be available 24/7. That's the 575-4400 number, and any calls, complaints that come into that number get triaged and get referred to the appropriate organization for follow-up monitoring and compliance activity. So there'll be lots of activity, monitoring activity over the weekend, and lots of monitoring activity early next week. And again, you know, I would say, I've said it all along, our goal is compliance. And largely, we've seen in this community really good compliance with the emergency orders and the guidelines. You know, the number of charges that have been laid are really relatively small, given the scale of the community and the duration of the enforcement orders.
Okay, that's it. Thank you.
Thanks, Nicole. Last, I think we'll hear from Damon at Woolwich Observer if Damon's worked out his technical issues. Damon, are you there now? Oh, okay. No questions today. All right, and Kevin has let me know that he doesn't have questions, so I'll do one last call before we wrap things up. Joanna, go ahead.
Thank you. Just another question for Dr. Wang. So opening up the testing to anyone in the region with symptoms, you mentioned self-referral. So could you just explain a bit more the process for how people can get the testing now?
Sure. So we have 5 testing sites, and 2 of those sites have let me know that they will be accepting patients or residents rather than the community, calling them directly to book an appointment. And so I should have that information very soon on our website. I'm just waiting some details from our testing partners. And so that's going to be an option at this point for 2 of the 5. The other 3 will, for the time being, continue with the process that we've had to date, which is through referral from a primary care physician. So, but those things could continue to evolve. And so if they do, and we get updated information from our partners, we'll be posting that consolidated information on our website.
Great. So then if a person is calling to book an appointment, do they need to do the self-assessment tool online first, or can they just call because they're sick?
Yeah, no, they don't need to do it. They can just call. The self-assessment tool is helpful if they want to know, if they have symptoms, what they should do, but they don't have to do it for those sites that will accept people calling them directly to book an appointment. When they book, there'll likely be some screening questions that they'll be asked by the testing partners, but they themselves don't have to have a filled out form or anything that they do beforehand.
All right, thanks so much.
Thanks, Joanna. We have one other question from Paula. Go ahead, Paula.
So just a kind of a terminology sort of question. Is it fair to say basically that people in our region are going to see testing increase sort of twice in the next little bit? Like, first of all, when you release the numbers of the tests that you hadn't counted previously, and then again as everyone with symptoms is tested or is allowed to be tested?
Yeah, no, that's a good question, Paula. So for sure, as of tomorrow morning's refresh, those numbers will go up significantly in terms of total numbers that have been tested or total number of tests that have occurred to date. What we are doing today is expanding eligibility for anyone in the community who has symptoms to be tested. The partners are expanding that eligibility in line with the provincial guidance as of today. So yeah, what they and I hope to see is definitely that more people take advantage of that option. I think a number of people, as I think we've all heard, have wanted to be tested when they've been symptomatic, but if they didn't require hospitalization or they weren't in one of the priority groups, they were told that they were not being prioritized for testing. But now there are no more priority groups, and so I'm hopeful that anyone in our community that has symptoms that could be related to COVID-19, that they consult a primary care provider or take the self-assessment tool, and or for those sites that accept self-referrals, call those sites and get tested. Ultimately, it is the goal of all testing partners and ourselves in public health, obviously, to see more people tested. And we want everyone who qualifies for testing to take advantage of that testing.
Thanks.
Thanks, Paula. So we have a question from Damon.
Mm-hmm.
Oh, he's asking something that I was actually going to update everyone on, so that's perfect timing. So I'll just check for hands one more time. Any other questions? Good. So just a reminder that before we conclude today, we will not be holding a briefing on Monday because it's a holiday Monday, but we will see you back here on Tuesday for a briefing update, and then again on Friday next week. Okay, so seeing no other questions, I think we can wrap this up, and we hope that you all have a safe and physically distanced weekend. Take care.